Welcome to today's video. If you or someone you know has suffered a traumatic brain injury, TBI, you may be familiar with one of the most common lingering symptoms, headaches. Today, we'll explore how a TBI can either cause or aggravate headaches, and why this connection is so common after brain injuries. Let's get started. First, let's talk about how a TBI causes headaches. When the brain experiences trauma, whether from a blow to the head, a fall, or an accident, it can lead to physical changes inside the brain. These injuries affect not just the brain tissue, but also the surrounding structures like blood vessels, muscles, and nerves, all of which can contribute to head pain. One of the main reasons people experience headaches after a TBI is because the injury causes swelling or bleeding inside the brain. This increases the pressure inside the skull, a condition known as intracranial pressure. Even a mild TBI, like a concussion, can cause enough swelling to trigger painful headaches, especially in the days and weeks following the injury. Another type of headache that can be caused by TBI is known as a tension headache. After a head injury, the muscles around the head, neck, and shoulders often tighten up, leading to discomfort and tension. These tight muscles can pull on the surrounding nerves, contributing to pain that radiates from the back of the neck up to the forehead. This is why many people with TBI experience headaches that feel like a tight band around their head. In some cases, TBI can cause headaches because of nerve irritation. When the brain experiences trauma, certain nerves, such as the trigeminal nerve, which is responsible for sensation in the face and head, can become irritated or damaged. This can lead to sharp, throbbing pain, often described as a migraine-like headache. Headaches caused by TBI don't always appear right away. For many, these headaches become chronic, lasting for months or even years after the injury. They may come and go or linger throughout the day, significantly impacting quality of life. The pain can vary from dull aches to severe, disabling migraines, and they often worsen with physical or mental exertion. Some TBI patients experience vascular headaches. This happens when the blood vessels in the brain constrict or dilate in abnormal patterns following trauma. This change in blood flow can lead to the throbbing or pulsating pain often associated with migraine-like headaches. Additionally, changes in brain chemistry after a TBI can trigger migraine headaches by affecting the balance of certain neurotransmitters. Each type of headache following TBI, whether it's tension-related, nerve-driven, or vascular, can be deeply connected to the way the brain and body respond to trauma. Sometimes, even the smallest triggers, like bright lights or loud sounds, can make post-traumatic headaches worse. To fully understand the extent of the brain injury and identify potential causes of post-traumatic headaches, your doctor may recommend imaging tests. Magnetic resonance imaging, MRI, is one of the most common tools used to evaluate the brain after a TBI. MRI scans provide detailed images of the brain structures, showing any swelling, bleeding, or damage to the brain tissue that could be causing the headaches. Another important imaging tool is the CT scan computed tomography. CT scans are often used in the early stages after a TBI to quickly identify bleeding, skull fractures, or other immediate concerns. While CT scans are less detailed than MRIs, they are useful for detecting acute brain injuries that may lead to headaches. So, in summary, TBI-related headaches can stem from multiple factors, including swelling in the brain, muscle tension, nerve irritation, and changes in blood flow. Understanding these underlying causes can help guide treatment, but the first step is often imaging to evaluate the full extent of the injury. If you've experienced a TBI and are dealing with chronic headaches, it's essential to consult with your healthcare provider to explore the potential reasons behind your pain. Thank you for joining us today. If you've experienced a TBI and are struggling with headaches, don't hesitate to seek professional help. Understanding the cause is key to managing your symptoms and improving your quality of life. Take care, and see you next time.